Hello, everyone. Welcome to a live stream of the Aging Together podcast, Season 4, sponsored by Heart Mobility, revolutionizing those steel metal gray bars that are from the 1960s with their newest product, Safety Grip. If you're tuning in live, please use the chat to introduce yourselves and ask any questions along the way. Our guest today will answer them at the end of the show. Today's guest is Dr. Mary Alice Mina, a Harvard-trained dermatologist, international speaker, author, and host of The Skin Reel, a podcast ranked in the 2.5% globally. As a co-owner of Botox and Mina Derm Surgery in Atlanta, Georgia, she is a leading expert in procedural dermatology, skin health, and skin care. With nearly 2 decades of clinical experience, Dr. Mina is celebrated for her artistic eye, surgical precision, and ability to help patients feel radiant at every stage of life. A sought-after speaker, Dr. Mina's insights have been featured in major media outlets, including People Magazine, The Wall Street Journal, Glamour, and Huffington Post. Passionate about empowering others, she combines her expertise with practical advice to inspire audiences to embrace their unique beauty and live confidently in their skin. Dr. Mina, thank you so much for joining me today.
Thank you so much. And I just realized I need to give you a shorter bio next time.
That's okay. I could have just kept it probably to the first paragraph, but I wanted everyone to know kind of, you're speaking with a lot of experience here, and, we want to make sure that you get credit where it's due. So thank you for being here. I'm really excited to talk about this topic. We haven't talked about skin health on this show yet, so I'm excited to see what the audience thinks about it, and they're probably going to have questions for you, so I'm really happy about that. So I was thinking maybe we can start, give us a little background on, your career, your journey, your passion for skin, and then because we're, a show about aging and aging, we were hoping to talk about maybe your experience with aging skin, older adults. And then I had a bit of like buckets in my head. So talking about like prevention and protection, kind of what you talked about when we first met. And then talking about, that's like sort of when you're younger. And then as you kind of start getting older, looking at like protection and care and how to care for your skin. And then really dive into what aging skin can look like with protection, care, and management.
Amazing. Yes, I call that pro-aging. And you kind of like
Love
nailed
that.
it, focusing on prevention, maintenance, and regeneration. So love to touch on all of that. And yeah, I guess a little bit about me. I've been in practice about 13 years. This is 9 years after medical school and training and all that good stuff, which shockingly flies by. And I love practicing dermatology. I love my practice. I love my patients. And everything was just plugging along really nicely and well until something happened in 2020, you guys might remember, called the pandemic. And it really just turned my life upside down like it did for a lot of people. And I realized that as much as I love being a doctor and being a dermatologist, patients were scared to come in. They didn't want to come in, and I don't blame them, right? And we were shut down for a little bit. And I realized here I am sitting at home. I had nothing to do. I was bored, and I'm thinking, how can I take care of patients if I can't physically see them? And I really took a deep dive into podcasting, realized I love listening to podcasts, and 2 years later decided, you know what? There's not a lot of really good skin information out there. There's not a lot of dermatologists putting, good information out there. So I thought, you know what? I'm just going to start a podcast. And so that's sort of the trajectory. And I realized that I had this very narrow view of what a doctor was, because that's really all doctors have been for, I feel like, centuries. But in this new world, right, like this postmodern world, we do things virtually. We want things quick and easy, and information is everywhere. So how do we know what information is good? And so I figure this is a great way to offer free education to people about their skin health. And, if I'm not out there putting information about skin health, then maybe someone less trained is maybe putting out bad information, which is what we definitely don't want.
That's great. Is precisely why I started this show, right? Was free education to the community. If not me, then they might be getting their information from somewhere else, and we don't know how accurate it might be, right? Unless they're, of course, another licensed trained professional,
Exactly.
which doesn't often happen to be the case, unfortunately. So, okay, let's dive right in. Do you want to start with prevention and protection, as you know, for younger skin?
Absolutely. Yeah. So I think also we need to reassess how we think about aging just in general. Our lifespan has just, exponentially increased. I was given a talk and I was doing some research. I think in the 1900s, early 1900s, the average life expectancy was 47, which is crazy because I'm 45 and I cannot imagine like having 2 more years and that's it. So nowadays, right, I believe it's like 76, 77 here in the US. And that number is just predicted to continue to increase. My grandmother's 102, right? Like I see patients in their early hundreds. It's,
Yeah.
it's still rare, but I'm seeing more of it. So we have to sort of think that nowadays the challenge isn't surviving through childhood or surviving, we have so many diseases we have vaccines for and all that, but now we have like chronic conditions. And now we're seeing the effects of our bodies living so long and our skin and what happens to it, especially as women postmenopausal, right? We've never lived in this long in a postmenopausal state and what that does to our body. So I like the term pro-aging because we're all going to age, right? If we're not aging, that means we're dead, and we don't really want that either, right? So anti-aging isn't really the goal. We really should think about it pro-aging, a focus on longevity and vitality, right? And so that's sort of how I like to reframe it. Number one is prevention, right? Because what is it? An ounce of prevention is worth a pound of cure, right?
Mm-hmm.
So I see skin cancer, so much skin cancer, and I treat a lot of skin cancers and a lot of sun damage. And it's like, man, and the patients will actually tell me, they say, I wish I had known. Back in my day, we didn't even have sunscreen, or the highest SPF was 8, and we would sit out with the aluminum foil and tan, and our parents would say, don't come in until the sun goes down. So I have hear this from this older generation lamenting about having all these skin cancers and all the signs of sun damage because they didn't know. But nowadays, we do know, right? And it's unfortunate that there are people trying to say the opposite or confuse people. Skin cancers are one of the most preventable cancers out there. Not 100%, right? Not every skin cancer, but the overwhelming majority can be prevented with sun protection, and that includes sunscreen. So I like to think with prevention, having a healthy relationship with the sun. The sun is amazing. The sun is powerful. We need the sun. It's essential to life. But for a lot of people, we're getting too much sun and our skin can't handle it, and we're damaging our DNA, and then we're seeing premature aging. We're seeing skin cancers down the road. So sun protection is a huge one. Simply taking care of your skin. I read this article a patient sent me in the Wall Street Journal about a man in his 70s who really had never focused on his skin health at all. He started getting all these skin cancers, and so he decided to make a change. He was going to actually wash his face, use sunscreen, use moisturizers, use skincare products. And he said he wasn't sure it was working until people just would stop him and say, you look really good, or you look well rested, or what's different about you? Something looks better. And the power of just taking care of your skin, just like you would, you have a healthy diet or you exercise, right? And it doesn't have to be complicated, but to give it some thought, whether it's simply washing your face, putting a moisturizer on, maybe an antioxidant serum, those are all part of prevention. And then I'd also say practicing healthy habits. So not smoking, right? Which a lot of people, I feel like we've gotten away from smoking, but now vaping is the big thing, right? And it's like, oh, it doesn't smell. It must be safe. So, now we've got to like warn people about vaping. Diet, exercise, sleep, stress management, all of these things. Like if we can work on these habits, the sooner the better. That is super important with prevention.
Yeah, I think you touched on a lot of things here, especially related to sunscreen, like sun protection in general. Growing up, culturally, we didn't use sun protection. It's just not something that we were well educated on. And as I got older, I don't think I realized it until college when, some roommates were like, do you have sunscreen on? And I'm like, what do you mean? And it's that misconception of if you have darker skin, you don't need sunscreen, right? And so I think education is probably the number one thing that really can help people just in that prevention protection phase.
Right. And you know
When
what's
you,
funny? I also find that sometimes people with darker skin are better about sun protection. Like I will see someone with darker skin carrying like a parasol or an umbrella or sitting in the shade, and then someone who has more my complexion is like actively out there turning red as a lobster, trying to tan. So it's just like I'm like, oh my gosh. I think everyone, we need to come to the point in like 2025 of like embracing whatever skin color you have and not trying to be lighter or darker, and then just like acceptance and loving whatever skin you have. But yeah, it's definitely a myth that if you have darker skin, you don't have to worry about it.
yeah. I learned that. And thankfully, my cousin, who's like a sister to me, is a PA in dermatology. And she got me onto like daily sunscreen. So I've been wearing daily sunscreen for, oh gosh, a few years now. And you can tell the difference over time. I think it really does help keep you. And then like a hydration thing at night, right? And that's sort of my next question is I feel like there's so much on the market when it comes to skincare, right? Like you see aisles and aisles of skincare products from like, when we're talking about pro aging, don't even get me started on the anti-aging shelves, right?
Right,
But
right.
but even with like hydrating formulas to serums to face cream to face lotion to like all of this stuff, what is your sort of take on like what is the bare minimum that
Yeah.
someone should be using, right? Because if that's part of, I think that's part of it. Like you go to the store and you see a million products, and unless you're well educated on them, you don't really, it's a little overwhelming.
Oh my gosh, it's more than a little. I get overwhelmed going. It's so much. And yeah, there's so many things out there. I will get reps that come to our office to talk about the newest sunscreen, the newest this. And I'm like, oh my gosh, like how can this really be that different from the one you showed me 6 months ago? Right. And so it is overwhelming. And you don't have to, you have to remember like these companies their marketing, their goal is to get you to buy things and buy more of them and to always feel like you're missing out if you don't have the latest. And you just have to remember, like, if it's working for your skin, you don't have to change it. I've been using the same Dove Beauty Bar for, I mean, probably going on like 20 years now, almost 20 years. And people try to get me to use other ones. I'm like, why? It works. I haven't had a problem with it. It's very cost effective. So don't feel like you have to always the shiny object syndrome, right? Like always
Yeah.
go for the latest, greatest or whatever. Find what works for you, what you like, what works for your budget, and just stick with it. And just I say cancel out the noise. Like you don't have to listen to all of that other stuff out there. But a real basic skincare routine should include a gentle cleanser, a moisturizer, and a sunscreen. And for some people, like I had very oily skin, especially when I was younger. I didn't even need a moisturizer. Sunscreen was hydrating enough. So that's what I used. And, people like my mom, that is all she does. She's almost 70. She could have any treatment she wanted. I could prescribe anything for her. And she's like, nope, I'm good. I don't need it. So there's absolutely nothing wrong with just doing that. And, you can buy these products at the drugstore. You do not have to, spend a fortune or go to specialty places. There's nothing wrong with the drugstore brands. In fact, they're big name companies. They have a ton of money spent in research and development. They do clinical trials. So that is a great place to start if you're a beginner. And if you are a little extra, I want to focus on a little more of the maintenance and regeneration. I'm 45 now. And so I do add a tretinoin, which is a vitamin A cream at night. And I do an antioxidant serum in the morning. But that's it. That's all I do. So all these like single item products, hyaluronic acid or like niacinamide or ceramide, like all these different things, chances are the products you're using already contain them and you probably don't need to go out and buy a separate product just for that. So I would say the first step is to look at what you're actually using. Look for those buzzwords you've been hearing about that you might think, oh, I need to go buy that. First, do a scan of the products you're using, and probably a lot of these ingredients are already in there. A lot of times they're already mixed together, so you don't need to go get a separate product. Now, if you're struggling with acne, rosacea, hyperpigmentation, scarring, what have you, you're going to want to have something to target that. So I'm just talking about sort of like your run-of-the-mill regular skincare. You're not trying to treat anything particular.
So while you're on that topic, how do you start managing some of those chronic conditions, right? You just mentioned a few of them that often start, I feel like I usually see them even as young as in the 20s, right? But then you definitely start seeing more of them, I feel like, as people are in their 30s, right when they're starting to get all a little sensitive about how their skin looks and feels. And, so how do you, I guess, one, separately manage those chronic conditions that are not necessarily degenerative or fatal, right? But they're skin diseases. And then also pair that with that aging skin that people naturally start becoming sensitive to.
Yeah. So I would say your first step would be see a skin expert, see a dermatologist, right? Who can help guide you. Could you figure this out on your own? Maybe, but probably through a lot of trial and errors. Your dermatologist might be able to prescribe a prescription strength medication for rosacea or a lightening agent if you tend to have hyperpigmentation that's stronger than over the counter things. So I would say this is where having a relationship with your dermatologist is so important. And look, I get it. I know it's hard nowadays. It's hard to get appointments. It's hard to have your questions answered in 5 to 10 minutes. And so again, this is why I also try to put information out there, but it really just depends on what you're trying to treat and manage. And then kind of what season of life you're in. If you're pregnant, struggling with acne, we're going to treat that very differently than if you are maybe perimenopausal and struggling with acne. So there are going to be some differences with that as well, and some products that are safer or not as safe. And so there are things to consider as well. But I would just say if you are struggling with these, see an expert, right? Like just know you don't have to struggle alone. There are a lot of things we can do to help.
Yeah, I think, that's really important. And understanding and knowing that what works for one person might not necessarily work for the other person, right? Is that true for chronic conditions too, like rosacea and stuff? Like what works for one might not work for another?
It is, right? Like we're all unique, we're all individuals. So medicine's an art form, right? I wish it was like, I can give you this and I pinky promise it's going to, do X, Y, and Z. And now we can sort of say like most people respond really well to this or that, but there could be some variations. And I think it also depends on like, do you have dry skin? Do you have oily skin? My skin can handle something very different than someone with really sensitive skin. I have different concerns. Like I don't hyperpigment. My skin tends to get pink. I tend to get more rosacea versus someone who might get hyperpigmentation. So there are some, universal truths and products that we know work really well for rosacea versus acne or what have you. But yeah, everyone is unique. And it also depends on, people will ask me, how do I know kind of what skin habits I really should be doing? I say, well, you have to pair your needs with your goals. So that's the other thing. Your skin needs are one thing, but also what are your goals? So like, for instance, today I saw a young woman. She had acne and she was on an over-the-counter medication. And previously when I'd seen her acne was still pretty severe. And so I was starting to suggest all these other things we could do. And she kind of was like, you know what? I'm good. I'm okay with what I'm doing. And I don't really want to do anything else. And so when I saw her again today, her acne actually had improved a lot. And she's like, I'm still good. I don't want to do anything else. I'm happy where I am. So we also have to take into account like what the person wants too, because someone may say, I'm not okay with like a single wrinkle or blemish on my face. And someone else could be like, this is simple. It's easy. I'm happy. So I think a lot of those factors, and again, that's the art of medicine. That's why, I don't AI and some of these like platforms that just dispense prescriptions, like they're never going to take the place of someone who you could have a relationship with and really have that sort of longitudinal connection.
Yeah, absolutely. I mean, taking patient considerations into our decision making is one of the number one rules of any level of healthcare, right? So that's really important. So when we're talking about, that I want to touch on this topic that really comes up like right in your 30s and 40s. I feel like Botox. Can we talk a little bit about Botox and like pros, yes, no, like when not to, kind of what's your spiel on that?
Yeah, so I think it's a phenomenal product. It was developed, well, I would say it was gosh, I want to say it was the 80s, where a dermatologist and an ophthalmologist were using it. And actually, they were using it in ophthalmology to treat something called strabismus, where the muscles of the eye were not, they were too tense. They weren't focusing, they weren't moving the eye. Together. And so they would put Botox into the muscle to relax it, to calm it down. And the ophthalmologist who was doing this would tell her patients, her name was Dr. Jean Carruthers, and she just passed away. Actually, don't quote me on that. Maybe it was her husband who passed away, but she tells this funny story of how she would tell her patients, hey, great news. It worked. Your strabismus is treated. You don't need any more Botox. And the patients would say, but I want it. And she's like, well, what are you talking about? Like, well, I don't have those frown lines anymore. I want to keep getting the Botox. And that's when she kind of started to realize, like, oh, it's doing something to the skin around it. It's working on our facial muscles, and it's actually preventing that scowl expression. And she jokes that she started injecting it in herself, and then and she's never frowned since. So I think that's a pretty funny story. But so it was originally developed for medical reasons to temporarily weaken the muscles of movement. And so we use it on the face for things like the scowl lines in between your eyes, or your forehead lines, or the lines on the sides of your mouth, any muscle of movement. So it's not going to work if you've got what we call static lines. You've got lines at rest. So like these lines right here on the sides of your nose, Botox isn't going to do anything with that because it's not a line that develops from moving my face. And what I think is great about it is it's temporary. If you don't like it, you never have to do it again. It can be done very safely, and it can be done very naturally. I think people hear the word toxin, they get really freaked out. And what I say is, look, it's a natural aesthetic treatment. I mean, they harness the natural toxin from a bacteria called Clostridium botulinum, and they have used that toxin medically and aesthetically. So I think it's a pretty cool way of using nature in medicine. But I think people get scared. The name, it has the word toxin. And secondly, they've seen a lot of maybe bad Botox, and people look weird. They can't move their face. They can't emote. It looks unnatural. And they think that's going to be them. But it can be, and it should be done in a very natural way. And then as far as safety, my son had something called torticollis when he was a baby. He had a very tight muscle in the neck. He did PT, he had surgery, and he still had a tight muscle. And he got 100 units of Botox when he was about 12 months old. And it was a game changer. He could finally turn his neck. He could finally look to the left. So I would never give this to my 1-year-old if I didn't have the utmost confidence in its safety. That being said, it's not for everyone. If you don't want it, you never have to get it done. But I do find it's a very safe starter treatment for people, and it can really just soften expressions and thereby prevent deeper lines.
Yeah. I was going to say, when you mentioned your son and torticollis, that was all actually initially what I knew it for was
Right,
muscle relaxing, right?
right.
So in rehab, we use it for muscle spasticity, especially after someone has had a stroke. And so I know it from that angle, or, sometimes children with cerebral palsy, so we're using it as a muscle relaxer, essentially. And so that's how I knew it as. And then, I got into my 20s, and then all of a sudden started hearing about people using it for their facial muscles, and that makes so much more sense the way you just explained it. Now, I want to focus a lot on our older population because we see a lot of varying levels of skin issues with older adults. So, some things that we talked about when we first chatted, things like dry skin, frail skin, abrasions, tears, ulcers, right? All of these things. And then how they're managed, right? So whether there's a whole system around wound care, which, could probably be an episode on its own, but also the factors that impact all of these different things, right? When older adults are on blood thinners, if they're a high fall risk, if they're falling a lot, if they bruise easily, can you talk about kind of that whole general area of, what do you see? What do you advise to these older adults and their caregivers? And what are
Yeah.
some protection, prevention, management strategies.
Right. Yeah, it is. It's something I see all of those things like on a daily basis. And then I might have to cut a skin cancer out. And now I've got to try to close that delicate, can sometimes be like tissue paper and just really tear so easily. So it's definitely an issue. It's a concern because when you've got tears in your skin and your skin's, all these open sores, it can take a while to heal. And, being on blood thinners, you can get things like hematomas, you can get infections. So these are not just, oh, it's just your skin, no big deal, right? Like these are real concerns. And then of course, like hospitalized patients or bedbound patients, right? Pressure ulcers. There's a high mortality with that, right? And people getting, and also just very poor quality of life having these. So again, like prevention, right? Like if you can kind of think about your skin as more than just aesthetically your face, think of it as an organ system and taking care of it. What you eat makes a big difference. As we get older, we lose muscle mass. We typically are not eating as much. So maybe having low caloric intake, having low protein, this can all affect wound healing. And also, again, not to like harp on sun damage, but the sun really just makes that collagen just disappear. I look at the skin under the microscope and you can see where it used to have nice pink healthy collagen, and now it's just been degraded and it's just like mush in there. So prevention is huge, right? Sun protecting is a great way to help keep your collagen robust. Eating enough protein, weight exercises, resistance training, that can help with building muscle and building collagen, which can be helpful. I actually love when my older patients tell me they go to the gym 3 times a week and they're really trying to move their bodies. I think that is so, so important. And I love that we see this older population. Sometimes I'm like, you're getting more exercise than I am. So focusing on that, focusing on movement, focusing on that whole body health is going to help with skin health. But it can be a challenge. And we see just a lot of skin cancers coming out. And for some, they can be really aggressive. And it also can be hard to know what to do, because I had a gentleman in his 90s with a basal cell behind his ear. And his son told me, I don't want you to treat it. I don't want my dad to have this done. It's surgery. It's going to take a lot out of him, even though it's local anesthesia. And he said, look, he's in his 90s. Why are you going to do that for a basal cell that's not going to kill him? And so we all agreed, we're not going to treat it. We left it alone. Then about 5 years later, he comes back to see me. That basal cell has not gone away. And now he wants me to treat it. And he was telling me it now had become basically a sore that just oozed. It smelled. It got blood all over his pillow. And he was tired of dealing with it. And at that point, it had progressed enough that I wouldn't have been able to remove it to cure that cancer without having to really disfigure his ear or do a really big closure and repair. And we sort of all agreed that that wasn't appropriate in someone in their late 90s who really just wanted this lesion to stop being a sore that wouldn't heal. And so we ended up just kind of trying to cut out the bulk of it and close it up for him, knowing that the cancer was still in there. So we have these challenges with our older populations, like, how aggressive should we be with these skin cancers? Typically, they're not going to kill them. They're going to die with them, not from them, but they can still create very problematic sores and wounds that just don't heal. So it is a challenge. I don't have like all the answers by any means. Again, early detection is key. Preventing that sun damage, trying to keep your body as healthy as possible. These are all just like great steps for having healthier skin as you get older.
Is there anything that can be done once the skin starts to already be frail? You start seeing that it's almost translucent, right? Like when the skin starts getting really, really thin. Is there anything that can be done to try and rejuvenate it a little bit?
Yeah, I mean, I think it depends sort of where you are, but certainly things that you could try. Biostimulants are a great way to stimulate your own body's collagen. So you could try, like we do this a lot on the face, try to inject Sculptra, Radiesse, those are brand names, to help stimulate collagen. I've, injected it sometimes people's forearms to help that skin that tends to tear pretty easily. Lasers can help, depending on the wavelength that's used. That if its target is water, that you can, and it goes deeper, you can boost collagen that way. There's some reports that collagen supplements could be helpful for people. I also think just like eating protein. This is something I used to be vegetarian for like 28 years. And I was just realizing I was craving a lot of carbs, I think, just to get calories. And really what I needed was like some lean chicken, right? And so somehow getting protein, however that looks for you, into your diet. And a lot of my elderly patients, they don't have much of an appetite. They're not eating a lot. So maybe that's a Ensure shake or some sort of supplement to help them get the appropriate calories and protein into their diet.
Yeah. It's definitely hard as a born and raised vegetarian who is still vegetarian
Yes.
to this day.
Yeah.
That protein source is always one of those, the protein and collagen. A lot
Yeah.
of the collagen supplements too are sourced from cows, right? Bovine. And so it's really difficult to even find like a good alternative for that kind of stuff. And so I think culturally we see a lot of issues with skin as we get older too for that. In the hospital, we see a lot of issues with frail skin because IVs get really hard,
Yes.
right? So
Yes.
we can't, maybe you find a vein, but the skin is so frail that it ends up blowing the IV, or it creates a huge hematoma around it, right? And then it takes forever for them to heal from that. And all of a sudden, we have a patient who's been here like maybe 4 or 5 days, but now is black and blue on their arms because they went through so many IVs.
Right. Yeah. Or like I just had a patient call who lower legs, right? Like lower leg wounds take a long time. They take a long time in someone like, your age or my age, but especially as we get older, just not as a robust blood supply. And a lot of people get edema or swelling in their legs. And so then, or diabetes, right? And that can really be a struggle. And she had been hospitalized. She was, had put on a lot of like water weight that they were trying to remove. And so her legs were super swollen and she's, trying to heal this spot on her leg and tears on her leg. So it is a challenge. It is a challenge. And our guidelines now in dermatology are for people to stay on blood thinners when we do surgery. And I'm seeing definitely a lot more hematomas where they bleed under the skin. And this has required second procedures to open it up. It could be sort of an area prone to infections. Seeing a lot of blood thinners sort of amplifying the bruising and bleeding that can happen. So it is a challenge for sure. And hopefully we can come up with something in my lifetime that we can use to help booster that collagen as we age.
Yeah, that's so interesting that they changed the clinical guidelines on the blood thinners because
Yeah.
I agree. Like, I feel like, I don't know, I'm telling my parents to even be careful with like a knife, because I'm
Yes.
like, it's not
Yes.
going to heal well. Like, you want to, so like to think that you would willingly like put an incision,
I know.
on a blood thinner, like that just makes me really nervous.
It's a challenge because then even if they don't bleed that much for me because of lidocaine and epinephrine, when they go home in a couple hours, that wears off. And then if they are bleeding, that first of all, that can be really scary. And they have maybe a hard time putting really firm pressure on the site for as long as it needs. So it's not inconsequential. I guess you could say, well, it's not a stroke. It's not a, pulmonary embolus or a stent clotting, but it's also not inconsequential, especially with all the patients we have on blood thinners nowadays.
Yeah. Something else you mentioned was about wound healing, and I feel like we see a lot of that with type 2 diabetes, and unfortunately, a lot of them in the with the lower leg, foot wounds, foot ulcers, you end up seeing amputations, and that is a whole nother beast of its own, right?
Yeah.
Do you have, maybe that's not quite on your radar, but like, do you have preventative strategies on that for those individuals living with type 2 diabetes?
Gosh, I would say, trying to get your insulin, your sugars managed is huge, right? But easier said than done. I know, we do at least have medications nowadays that can be helpful. But if I do have someone with pretty severe diabetes or side effects and they have a spot on the lower leg, or I discussed other options. Like, do we have to do surgery? Like, maybe we could try something less invasive first, just because I'm concerned about healing. But another thing, if we have to do it, we have to do it. Compression socks. I'm a huge fan of compression. I wear them. I know they're not sexy, but if you're at work or you're wearing pants, like, no one sees it. So I wear them with my scrubs, and I recommend my patients get them. I know they're tricky to put on for a lot of people, but I've been encouraged to see Velcro ones, zipper ones out there. So there are ways to do it, but just getting some compression on those lower legs, it makes a huge difference with wound healing.
Yeah. I am curious because with our training, compression over open wounds is contraindicated. So do you recommend that even with a wound?
Yeah. Well, most of my wounds are kind of acute surgical wounds, but I
Sure.
recommend it's covered, right? It's covered, it's
Right.
clean, it's not an active infection, right? So maybe maybe people are more
Maybe
worried
that's
about
why.
like
Yeah,
an
sure.
active infection, but really, if you want a wound to heal, it has to have compression, I feel like. So I have no problem doing that. In fact, I recommend it. All my patients with lower leg wounds, cover it appropriately, get that compression on, and I'm just amazed how quicker they heal doing it that way.
That's interesting. I'll have to look into this more on our end. I know
Yeah.
we have a lot of contraindications with like lymphedema patients who need wrapping, but then they have weeping, edema, and there's other like sores and open wounds, and we're not, we generally are advised to not compress over that.
You know what I love? Una boots. You guys do those, or you seen them? I mean, those are like in the hospital, weeping wounds, a lot of edema. They are basically like two wraps on the leg. Think of like an ace bandage, and you put zinc oxide on the skin as like a barrier, and then you wrap them, and it's tight, and it doesn't look pretty, but it works. So I'm a big fan of those as well for more severe cases.
Wow, two things to look into. That's
Yeah.
really helpful. Speaking of more management, I want to talk a little bit about scar management because I think that looks different across the lifespan too, right? Like I had a benign fibroma removed and the scar management for that was very different. I mean, it was, let's put some of this silagel on it and let's give it some massage and we're on our way. Also, younger skin heals faster, right? There's different methods to that. But my first time, it turned into a keloid and I had to get it redone, right? So there's differences in how skin heals, even at the different stages of life. But how does scar management change through that process too?
Yeah.
And does
Well,
it? Maybe it doesn't. I don't
yeah,
know.
I mean the actual like post-surgery instructions, maybe they vary a little bit, but the most important thing, if for anyone listening who doesn't know, is it doesn't need to air out. It does not need to form a scab to heal. That is fake news. So we actually recommend keeping it moist. That provides a hospitable environment for wound healing. It also helps prevent bacteria and fungus and microbes from getting in. So a thick layer of petrolatum, Vaseline, Aquaphor, non-stick gauze, which is like the white shiny part of a band-aid, not the kind that looks like cotton. That goes over the wound, and then secure it with tape. That's sort of like general wound care instructions. What I will say is, depending on where a spot is, sometimes my older patients, the scars disappear so fast. It's like magic. And I think a couple reasons. They are perhaps not as active, so there's less tension on the wound. And granted, I might have more like little creases. I call them natural creases to hide the scar in versus someone who has not a blemish around. But I find young people, they sometimes, they're great healers, but they sometimes overheal. And so like a young person, if I have to remove something on their back, I almost promise your scar's going to spread. It's going to stretch because you're active, you're young, you're moving around. And it could spread. Sometimes it can become thicker, more hypertrophic, or even a keloid. I don't see that as often in my older patients. And sometimes the scars, they can stay really, really pink or purple looking for way longer than my older patients who, you would think aren't healing as well, but the scars do seem to disappear. So there are some challenges with younger patients too with scars. And sometimes if it really doesn't have to be done, I'll advise, hey, wait till kind of through puberty or wait till you're a little bit older if you don't have to have this done than the older patients. But yeah, I mean, the older patients, the challenge is the skin thick enough? Do I have enough integrity to pull it together? Are they on blood thinners? And can they take care of it? But I do find for a lot of them, the scars don't stretch. They're not as often hypertrophic, versus my younger patients. They almost overheal in a lot of cases.
That makes a lot of sense. I mean, the first time I got it done, I was still actively working 40, 45 hours a week in the hospital. And, he said, don't use your arm too much. I'm like, that's
Right.
just not going to happen. Like, I'm going to use
You're
my
like,
arm all
okay.
day. And then I got the revision done and I was not working full time anymore. And it was just an easier process of like, okay, I can actually keep my arm still, for a week or whatever. So that is also really interesting. Kind of leaning towards closing up, I always like to leave the audience with a practical tool or strategy. So related to skin health, maybe what is your one go-to resource or tip or mindset shift that you wish individuals knew about skin health?
Well, I guess, I mean, so many, right? But I would say that your skin is more than just the aesthetics of your face. Your skin is an organ, and really great skin health starts by taking care of your body. And this isn't, no one's going to be able to sell this. And so you're not seeing it marketed to you on billboards. And then I can't put this in a bottle for you or a supplement to take. But by really, truly taking care of your whole body health, that includes your physical health, nutritional, mental, all of that. It's going to be reflected in your skin. So our skin, what I think is so cool about it, one of the things is it's like a window to the health of the rest of our body. And I can sometimes diagnose these internal things before anyone else in the medical community because of skin findings. The skin is like a window to how well you're taking care of your body as a whole, right? I think we all can relate to going out too late, partying, drinking too much, not sleeping enough. Well, guess what? You wake up, you don't look great. You look awful. And the older you get, the harder it is to bounce back. So nurture your body, take care of your body. If skin health is really your goal and aging well and pro-aging and all that, like the topicals, the serums, the potions and procedures that we can do, that's like the last 10%. And you really have to focus on skincare from the inside out, I think, for the best result.
Yeah, that's really, really powerful to know that. I feel like we didn't really touch on that, but the difference in even the different types of acne, right? Like you can have cystic acne or hormonal acne or stress related acne. And I think people forget that those kind of things are preventable. I have been starting to add this question around policy and sort of our healthcare system at large. A lot of these events, as long as they're diagnosed, can often be covered under health insurance. But a lot of them, if they're considered cosmetic, then they're not covered, right? And so when it comes to more of these older adults, do you see that they're more often covered?
So things like skin cancers and lipomas, cysts, things like that, acne, those are all covered by insurance. But, it seems so random, right? Because the scarring from acne is not. So,
right.
And guess what? Acne goes away. The scars stay forever. So that's not considered, hyperhidrosis. This is excessive sweating. And I'm talking like to the point where it's affecting them getting a job because they are scared to shake someone's hand, right? Or they have to change their shirts multiple times, like really affecting them. That's a medical condition. And botulinum toxin, Botox is indicated. And yet, it's not covered, or they say it's covered and they won't even reimburse the cost of the vial, right, to get it. So it is frustrating. Keloids, right? Like sometimes they're considered cosmetic, sometimes they're not, right? But that's a medical condition. So in dermatology, there's so much of this, and it just seems like it's getting harder and harder to get things covered. And it's frustrating, but I will say typically for my older patients, especially my Medicare patients, as of now, skin cancers, skin cancer screenings, biopsies, these are at least covered under insurance.
Okay. Yeah, that's good to know. So then related to that, if you could wave sort of a magic policy wand, what change would be the most beneficial when it comes to skin health?
Gosh, if we could just like silence all the fake noise news out there, like skin cancer or a sunscreen causes cancer. I mean, even these ingredients will become vilified without any real data, and people just fall for it. Even the businesses are like, okay, no one wants parabens, even though there's been no data, real data to show they're harmful, and so everyone just follows suit. So I just wish, I wish people also knew who to turn to. There's so many people out there who will make it sound like they're dermatologists, and they're not, right? They'll say, oh, I have a passion for skin or this. And there's a role, certainly, like estheticians know a lot about the skin. Primary care doctors may know about the skin, right? But there's so many people out there, I feel like, who are posing as skin experts and really just trying to sell you something, trying to sell you whatever supplement, whatever product, whatever, they're trying to get you to buy. And they don't really have your true skin health, putting that first and foremost. So unfortunately, it's really up to like the listeners, the consumers, the patients to do their due diligence and really look at who is giving you this advice, kind of what's their angle, are they true experts or not? Because in the skin space, there's a lot of cash-based procedures, a lot of cosmetic-based things. And I find that people are so afraid to age, or they're so concerned by what they're seeing, that they can fall pretty easily for snake oil.
Yeah, yeah. Yeah, definitely need to get rid of a lot of these ads and socials, I feel. Before we wrap, what's one takeaway you hope that every listener or viewer walks away with after hearing from you today?
I hope they go away with this mindset of pro-aging, that we're not trying to anti-age. We're not trying to go back in time. We're not trying to look like we were 20. We're just trying to, the goal should really be, right? And again, this is like, no, not every day do I feel this way, right? It's like a mantra I have to say that, the goal is really skin longevity and skin health over our lifetime, and making the best of where we are at whatever stage of life we're in, focusing on really our whole body health. See your dermatologist for that last like 10%, right? To help that regeneration if you need it or want it. But I think just also accepting that it's okay to age. It's okay to look different. It's okay to not, removing every flaw, line, wrinkle, blemish, whatever isn't necessarily the goal, but really the goal should be to feel, I say like my goal with my podcast and all that is for especially women to look in the mirror and love what they see, right? And my goal is not to make you look like you were 20, but I want you to love and appreciate where you are. And that can include looking like you're 60 if you're 60, or looking like you're 50 or 45 or whatever it is. So I think just having this appreciation for where we are and reframing aging, especially as women, and I'm in midlife, I'm not going to assume you are, but at least for me is like that even in midlife, like I think it used to be, we felt like as women in midlife, you're just like put out to pasture, you're done. You're no longer like a vibrant, beautiful person. And I love to see that this narrative is changing. So I think more work to be done, but really it starts with like how you feel about yourself, and look at aging as a gift, not as something we're trying to stamp out any sign of.
Yes, yes. My grandpa always used to say that wrinkles are a sign of wisdom because of everything they've gained as they've gotten older, right?
That's right. All the stories and scars too, right? Like it tells a story.
Yep. Dr. Mina, thank you so much again for being here with me today. And it was a pleasure having you.
Lots of fun. Thank you for having me. And yeah, I would just give a plug to my podcast if people want to find out, more about skin and skin health. It's the Skin Real, REAL.
Awesome. For those tuning in live, thank you for joining us. I'll be back with another live stream in 2 weeks. See you then.